Hello, I'm Dr. Shirish Alurkar, consultant oncologist at Ahmedabad. In my previous two videos, which you can see on the I button in the video, I have described about the diagnosis of breast cancer and the treatment of breast cancer. In this video now, I will describe something about brain tumors, specifically known as glioblastoma multiformis. So, what is a brain tumor? Brain tumor is a very dreaded disease and it is very rare also, as I will show you in the subsequent slides. So, it is basically a tumor arising from the supporting cells of the brain. They are not, it is not a tumor of the neurons, but there are certain cells which are supporting the brain tissues. And that is what is known as the brain tumor, or what is known as commonly glioblastoma. Uh, so what are the risk factors? How does it develop? Every cancer has certain risk factors. Specifically for a brain tumor, you can say the risk factor is previous radiotherapy given to the brain, and there are certain other hereditary risk factors. For example, in some chromosomal abnormalities which are known to occur, which your oncologist will tell you whenever the biopsy of the tissue is done, and certain genetic mutations also are done to identify whether there are certain hereditary syndrome, which I call, where there are brain tumors with other tumors, for example kidney tumors and brain tumors. They can be seen in a patient or in a family together. Of course, alcohol and smoking always is a risk factor for any cancer. So even for brain tumor also, to some extent, alcohol and smoking also contribute. So as one can see here in this slide, the incidence of brain tumor is very less. The commonest incidence or commonest cancer, you can say, in India, as far as the one database known as Globocan, is of the breast cancer in females, and the head and neck cancers, that is area of the tongue and the cheek in India. And incidentally, Ahmedabad is the highest. They have the highest number of head and neck cancers in the world. The incidence of these cancers, breast and head and neck, is about 16%, 15%. Compared to that, the brain tumors is roughly about only 2%. So the number of the amount of patients, the number of patients are much less compared to the other cancers. So what are the symptoms? How does the patient come? Commonly, it is headache, there will be nausea, vomiting, there will be giddiness, forgetfulness. Patient doesn't remember what, for example, he has eaten day before yesterday or yesterday, or who he has met. He may forget names of people. He may forget the time of a certain event. So these are very small changes which can occur in the patient. There could also be visual problem. For example, patient cannot see properly. He may crash against the wall. He may fall down because he cannot see. So because he cannot really visualize what is happening. There may be weakness of one or two limbs because of the tumor pressing on the nerves of those limbs. So it's a very broad area, broad spectrum of symptoms and signs. How do you diagnose a glioblastoma? Commonly, it is done by an MRI, which is a scan similar to CT scan, and it takes a little bit more time than a CT scan. An MRI, I would say, is better than a CT scan to diagnose any brain tumor or any tumor going to the brain. After that, the diagnosis we need is tissue diagnosis. So this is done by a special technique known as a stereotactic biopsy, which I will show you. Or if the surgeon has opened up the skull or the brain, and he can remove the tumor, and then it is sent to the pathologist, and that is how you diagnose a brain tumor. So if surgery is not possible, it is only done by a stereotactic biopsy, which you can see in the next slide here. Here I have shown you here a specific needle going into the one of the deepest part of the brain. Anywhere in fact the needle can go. There is a very elaborate apparatus which is fixed to the brain here, and it is done under general anesthesia, and then the tissue is removed and sent to the pathologist. So is there any special test? Usually when you go to your oncologist, it is not just sufficient to diagnose whether you have glioblastoma or any other brain tumor. Your oncologist will ask for a certain special test. These special tests are known as genetic tests. And as I have shown here, these are the various genes which are mandatory, you can say now, to diagnose and to tell the patient whether the prognosis is good or bad, what type of treatment to select, etc. So coming to the treatment, what treatment? Unfortunately, the treatment options in brain tumor are very limited compared to, say, breast cancer or lung cancer, where you have a huge spectrum of treatment, targeted therapies, immunotherapies, surgery, radiation therapy. In brain tumors, the main treatment is surgery. If possible, the tumor has to come out by a neurosurgeon. Sometimes he cannot remove the tumor completely and something remains behind. and in those cases we give radiation therapy, and along with that we give chemotherapy. There is no role of any targeted therapy, no role of every immunotherapy. So you may hear in the market many people they are using immunotherapy, but that is all experimental. So what type of chemotherapy it is? Luckily it's just an oral tablet. It is known as temozolomide, as you can see in the slide, and it is either used alone, but most of it is used in radiation therapy. Radiation is given about 4 to 6 weeks, and along with that this tablet is given on a daily basis, and after the radiation is completed this tablet is given every monthly for about 1 year. So it's a long treatment, but very safe, very not much of side effects, and most of the patients can tolerate this treatment very well. There's another drug known as bevacizumab, which is the targeted therapy here, but it is only used in recurrent cases. So when patient has been treated previously, say 1 year back, and now the patient comes with a repeat tumor, that is when we oncologists offer this drug. It is expensive and it is usually given intravenously. Uh, so as you say, as this is a very aggressive tumor, consult your doctor immediately when you have some symptoms. Don't panic. That is the main thing. Get all the tests done by the doctor, including the genetic test and the mutation test. And even if there's a family history, get your other family members also tested. And if diagnosed early, any cancer, including brain cancer, can be treated with surgery, chemotherapy, and radiation therapy, and one can have an almost normal life. Thank you very much.